Bonjour tout le monde, je m'appelle Kate Busch, je suis de la SLA Québec.
Bonjour tout le monde. Hi everybody, I'm Leigh, also from ALS Quebec, and our presentation is on the development of our community of practice for healthcare professionals. So Sarah Feldman mentioned yesterday that she loved hearing about projects inspired by other presentations at the Alliance, and ours is no different. We wanted to send a little shout out to Jennifer Bedford. We were watching the APF virtually, Kate and I, in 2022, and when we heard her presentation on the development of a community of practice. And so we were texting actually during the presentation to be like, we need to find a way to do this in our community. And so we started discussing right away.
So some backstory. When I started at the ALS Society of Quebec in late 2010, we already had a table of partners. Shout out to Tony, to Mia, to Anne-Marie. They were involved in healthcare professionals who worked with ALS on a regular basis to talk about needs for families, but as well for healthcare professionals. So what we had done was we started creating education days. We created an aide-memoire. I'm sorry, there's going to be a bit of franglais in this presentation. So a memory aid for healthcare professionals about what you may or may not have to deal with when you've got a patient with ALS. And then it was in 2012 that we came up with an idea. We called it the Forum des Échanges, an exchange forum for healthcare professionals to get together once every 2 months over lunch hour in order to discuss particular needs for families with ALS. And so our first forum was in November 2012. It was a teleconference, which meant that we all got together on a telephone and we shared quite anonymously. Since then, we've done more than 50 forums, and we have an average of about 50 people per forum. Sometimes we've had as many as 100 people on the line. So some of the subjects that we've discussed have been discussing difficult cases, end-of-life options, organ donation, sexuality, case management, nutrition, imposed occupational transition, physiotherapy, communication aids. We even had a pretty fabulous forum before marijuana was legalized in Canada on medical marijuana with ALS. In 2020, with the pandemic, we switched to Zoom, and community of practice then sort of seemed like an active extension of the exchange forums, and to create stronger links within the community and make it available every day rather than an hour every 6 to 10 weeks. Leigh.
Thank you. All right, so in early 2023, we were trying to get organized, and I'll credit Kate, it was her idea to have a journal to track, our reflections, our actions, and to be able to really follow the process. We met with partner organizations that had expertise and experience in community of practice. And of course, we did some research on some platform options. It seemed that Microsoft Teams was an obvious choice because of its pervasive use in the healthcare system. And of course, then we created our team on Teams. We created a pinned post, which we'll show you later, a welcome post that explained the channels. We also developed tags for the healthcare professionals, so if a particular topic was of interest to OTs, we could tag them and try and nab their attention in particular, and language of use. We also created a couple of posts to kick off the discussion, namely the reflecting on the most recent exchange forum at the time. Yay!
So, we have pretty robust database of healthcare professionals in Quebec with over 1,100 healthcare professionals. So we invited all of them by email, including, of course, occupational therapists, physiotherapists, nurses, social workers, neurologists, nutritionists, SLPs, psychologists, psychoeducators, researchers, the list goes on. And we explained them how they could access the account and they responded, and we had very few issues with access. We launched on September 29th, 2023, and then 3 workdays later, we had already 160 people joining us. Our first post from the community came in early October, and then by October 19th or 10th, we were over 180 healthcare professionals.
So I wanted to give you an example of our pinned, thank you, Kate, of our pinned post. So we wanted to include the most commonly needed healthcare resources, resources for the healthcare professionals. So things like the guide for people living with ALS, our nutritional toolkit, the Canadian Best Practices Guidelines by Dr. Shoesmith et al. From 2020, registration forms to ALS Quebec, shameless plug for us, and our community support programs and many more items. So we thought so much about the content and we were like, where is everybody? So we thought we needed to address engagement. In terms of brainstorming for content, we wanted to think about the kinds of things we would want to post in the coming months. So things like awareness days, like Occupational Therapy Month in Canada or Social Work Week in Quebec, show our appreciation for our fellow allied health professionals, information regarding new approval for therapies, opportunities to participate in research and share those opportunities with patients. It tended to be non-pharma type things like caregiving or more clinical allied health projects. Oh, no, I'm good. Advocacy and policy articles relevant to our population, of course, exchange forum invitations, and in the last year, we've had many, many posts about the APF and the symposium. We also created a calendar to plan our posts and track engagement from the community. And then we also, since the engagement was a little lower than we'd anticipated, we reached out to the healthcare professionals in order to get their feedback.
So we got feedback from about a dozen healthcare professionals, and their comments included things like technical difficulties, that it was cumbersome to have to switch between a normal teams that they do in their day-to-day with work, and then to switch to a community of practice. Because what we did was created a guest account instead of doing it through our work account. So some forgot about the community of practice as they are not triggered by notifications or emails. Their notifications were going into their junk mail. So some weren't seeing the content. Some needed a code to access the team. And some weren't sure that they'd been properly added. There was a shyness and a desire to not bother anyone by posting subject matter, but the subject matter that was posted was actually really great. And some people weren't using it because it was rare that they used Teams. They didn't have time. Some people weren't working enough with ALS patients to find that it was useful. And maybe because some people asked if we could do a Facebook group instead, but that isn't possible with healthcare workers to be able to have Facebook access, whatever. Some changed jobs, some preferred emails, etc. So the platform challengers, we were thinking, like, how do we resolve this? Microsoft is aware that they need to integrate guest accounts to a main platform, but they haven't done this yet. So we're waiting on this adaptation, and we kind of, harass Microsoft to get them to be aware that we think this is an issue and they should do something about it. So as of April 2024, we started to see much more engagement, people liking and responding to our posts, but it still is not as much as we had hoped for, but it appears that people are starting to remember it as a possible resource. So where are we now? We were wondering whether our own expectations matched those of the healthcare professionals. And so we did another survey just recently to see what their thoughts were in October. The results were that expectations of a community of practice was to share knowledge and help each other, a place to ask questions, and to be informed of new developments. Their lived experience was that the feedback is that the posts are interesting and helpful, but those who did not engage, they do continually cite lack of time and inconvenience of toggling between the team platforms. But does the community of practice respond to their needs? It was an overwhelming yes, but we just really do need to deal with that toggling issue.
So I think I saw Liziane here at some point. I'm not sure if she's, nope, no hand raising. Okay, so we were in touch with speech language pathologist, doctoral, she's a PhD, postdoc, thank you. And she put us in touch with another person with community of practice expertise. Her name is Dr. Ingrid Verducht. And she's running a community of practice for speech-language pathologists. And so we were able to learn quite a bit from her. We spoke with her in October as well. And so here's some learnings that we got from that conversation. So mapping of our healthcare professionals. So she asked questions like, what unites the group other than ALS? Do we need subgroups? Do we need to specialize? What is the core message and who does that interest? And, Kate's mentioned it a couple of times, and I think we have an acceptance piece here where to integrate in the sense that not all healthcare workers working with ALS do it full-time the way that we do. You might have a case here and there, or, be more or less engaged with the community, and there's a big variety. And so we have to manage our expectations in terms of, it may not be normal for everyone to be as engaged as we would like to be on a daily basis. In terms of the team's challenges, Professor Verducht's experience was similar to ours. In fact, every year they review the platform options for their community of practice. They end up coming back to the teams as the lesser of evils for now, and are also anxiously awaiting Microsoft's update. But they use email backup while they're waiting for the improvements to the platform, which was reassuring to us as well, because that's something that we took on as well. And coming back to the table de partenaires that Kate spoke about at the beginning, there's a need to establish a core group of people. So people that could help identify people to launch forum discussions, people that would commit to posting regularly, and that will help with engagement as well. And so some of our latest reflections and plans for 2025, we would like to boost the frequency of the Exchange Forum. For a variety of reasons, the frequency sort of fell off the last couple of years, and it's something we really need to get going again. And the survey actually reinforced that feeling as well, that we need to meet more often. The other thing is that we're increasingly developing relationships with researchers and students, and so inviting them to the community of practice and to present to the healthcare professionals can help solidify those links. And a comment from one healthcare professional expressed a desire to have more case studies to analyze needs and solutions found to inspire others as well. So we're coming back to that collaborative theme that we keep talking about. So we'll continue to reflect on our process, and maybe we'll be able to give you an update next year.
Please feel free to contact us. Merci beaucoup.
Fantastic. Thank you so much. It's so exciting that you can find and meet people and kind of cross-pollinate and just share ideas. It's really inspirational. So thank you. And interesting enough, Jen is coming up next, and you'll be able to share more. Are there any questions in the room?
So I apologize, Kate. So I don't know if I've ever shared this, but there was a nurse from Switzerland that posted on your post, and then we hosted him for a week because he was setting up a clinic in Switzerland. So I don't think that ever, and that was all through the forum. So FYI, guys.
Thank you for that, Tony. It's great. It's great to hear that. Very appreciated. Thank you very much.
Are there any more questions? Are there any questions online? No? Lovely. Well, we'd like to thank you once again for your presentation. Thank you.
Thank you very much.